I'm Jackie. I'm one of the nurses here at the Medina Healthcare System. We have Dr. Munoz joining us today just to answer a couple of kind of common GI questions that we think would help benefit the community, just to put out there if anybody was curious. And we're super excited to have him. Dr. Munoz, thank you so much for your time to spend with us today and go through these questions.
Well, thank you for inviting me. It's a pleasure to be here, and I hope I can be of some help, and I'm able to give a little bit of pointers to the people that are watching and listening to us.
Absolutely. I'm sure you will. And if anything, I'm going to walk away learning something.
I'm a board-certified gastroenterologist. I've done some training at the University of Texas Health Science Center. I've done some training at the University of California in San Diego. I've done some research in gallstones and gallbladder disease. Although I'm not a surgeon, but I did a little bit of pharmacological studies and dietary studies in San Diego, and was in practice for about 30 years in the community in San Antonio, and decided to give it a try to go into a rural community, and the opportunity to come here to Hondo occurred and came at the perfect time when I wanted to do something to help this area, which I felt there was a need for the presence of a gastroenterologist. Being part of this clinic, I've had the opportunity to see very interesting and challenging cases, but we also deal with bread and butter basic GI, which I truly enjoy.
If it's okay with you, Dr. Munoz, I'll just go ahead and jump right in.
Right.
What would be some healthy mealtime habits for before we eat and after we eat, just to kind of help aid digestion and just kind of things that you think would work best for us everyday people?
One of the things that we know by physiological studies is that the body likes to have a schedule. The gastrointestinal tract is happy, so to speak, when we eat at the same time, when our foods, even though they may be varied, are similar. So trying to stick to habits is good. Eating the very important first meal of the day, which a lot of times we're in such a hurry, we'll just grab coffee or fiber bar, and we won't really pay attention to the relevance that meal is. We should eat ideally 2 hours after when we wake up. And then our next meal should be 4 hours later, which would be our lunch. And then next meal 4 hours later, which would end up being around our 6 o'clock in the evening, should be the last meal of the day. So consistency in regards to our schedule is essential. And obviously the content of the meals, and we'll talk about that, I'm sure, a little bit later, but try to be consistent. Try to always have plenty of fluids, and then the balance of the content of fiber in your diet, your protein, etc. Minimize your fats, especially animal fats.
You know, it's interesting. I'm definitely a coffee lover, so I will drink on that till almost 11 a.m. and then, you hit the crash. So that's really good to know. I never knew that, and that's super interesting. Thank you. The next question I had was, if somebody's experiencing abdominal pain, when is kind of the red flag zone for when they should seek going to urgent care or going to ER, calling 911? What's kind of the line in the sand there?
Pain is a very subjective symptom. What you may feel that is something that is a emergency, if somebody has a different threshold of pain, they may not feel that bad. But there are, as you pointed out, red flags that accompany pain, again, independently of the severity. First of all, if you see the presence of blood, since we're talking about the GI tract, blood in your stools, and pain is not good. Vomiting, not able to keep anything down while you're experiencing pain is not good. You look at yourself in the mirror and your eyes are yellow. That's not good. You've tried an over-the-counter remedy like Tylenol, for example, that certainly is means that there's something more serious going on. So every time I say not good, meaning that is you should seek care. Pain that persists for prolonged periods of time is concerning. So severity, yes, but again, watch for those red flags. That is crucial. And obviously, if you're a diabetic, sometimes pain, you may have a neuropathy and you may not experience that much pain. So that's when you even will depend more on on the red flags and the location of the pain.
The bleeding, especially, and the vomiting stood out to me. Those were big ones. And that's interesting, also just as, for my family, for my knowledge, if somebody comes to me with questions, it's like, okay, now I know. Watch out for these things. The next question I have is, I feel like acid reflux is kind of just a big common issue that I feel like at some point in their life, maybe every person, if not maybe every other person, might experience. Can you kind of just briefly explain like the disease process, and then is there any practices that should be avoided or should implement to kind of help relieve symptoms or just avoid altogether in your experience?
Acid reflux it takes two things for it to occur. One is you have to have the predisposition, the anatomical predisposition. And this is why, for example, hiatal hernias, which is when the stomach pushes up to your chest. So there has to be some anatomical barrier that we should have to protect ourselves, that when that anatomical barrier is not there because of the displacement that we may have on the top of where our stomach is and enters the diaphragm. If that is occurring, obviously you can regurgitate juices that you have in your stomach, and that can cause the symptom of heartburn or pain, or in some cases even difficulty swallowing. So there has to be an element, first an anatomical element. The second thing is there has to be acid that goes to a place where it shouldn't be for you to experience acid reflux. So when the stomach is very well adapted to tolerate acid, not the esophagus. So if there's displacement of the top of your stomach and juices that are acidic are reaching your esophagus, then you have the symptoms of acid reflux. So we have great medications to manage acid reflux, which you can take over the counter. Medicines like famotidine or Pepcid. We have Gaviscon, Maalox, Mylanta, suspension, liquid forms. And then we have the proton pump inhibitors that are medicines that are a little bit stronger than the two that I mentioned before, or rather much stronger, like the Nexium, the Prilosec, the Zegrid, all of those medications that can certainly be tried. Now, diet plays a very important role when it comes to acid reflux. What foods do we know that can trigger heartburn and acid reflux? Well, acidic foods, for example, citric, orange juice, grapefruit juice, lemon, lime. Foods that not only are acidic, but also have a high density, like, for example, tomato paste, tomato sauce of a pizza, salsa. Those things also can trigger acid reflux symptoms. Carbonated drinks, caffeine, which who doesn't want to stop at their Starbucks and get an espresso or one.
Yeah.
Definitely are great for business, as the gastroenterologist would say. Energy drinks, Monster, Red Bull, and I'm not saying that they're necessarily bad. It's just that some people will have these symptoms when they consume those products. Raw onions, garlic also can play a role. In some cases, chocolate can sometimes also give you acid reflux symptoms. Also, the time that you consume these products, because if you eat, and sometimes if you eat things that sound pretty benign and you eat them and you lay down, then you have gravity that works against you. So also the timing may not be good. And then it's a double whammy if you ate something that you shouldn't late at night. Then if you add a little bit of alcohol to a margarita or something like that, then you're a perfect storm for not having a good evening that night.
It's so funny that you mentioned salsa specifically, because I struggle with acid reflux, and I must have been going to town on the chips and salsa one evening, and I lay down, and man, I had heard that tomatoes were acidic, so that it wouldn't be, and I don't know why I didn't put the two together, and it was a storm, a hurricane, like you were saying. Thank you so much for that. Can you explain the importance of an endoscopy?
Well, going along with when I was talking about the acid reflux and red flags, if you're having issues swallowing and suffer from acid reflux, don't ignore that. That could suggest something a little bit more serious, like even something catastrophic as a cancer. But there could also be a stricture or narrowing, and you don't want to go through a food impaction on a Friday night when you're at a steakhouse. So you definitely should, if you're having issues with swallowing, you should have an endoscopy. If your symptoms are refractory to over-the-counter antacids, the typical rule is you try for a couple of weeks an over-the-counter antacid. And if your symptoms persist, you should set up an endoscopy to take a look into the esophagus, the stomach, and the first part of the small bowel. If you're losing weight, unexplained weight, definitely want to be sure we live in areas where there's a high incidence of gastric cancer. So that could be an indication that there could be something serious in the stomach itself. And then there is an association between celiac disease or gluten intolerance and acid reflux. So when you do an endoscopy, not only can you check for those other things that I just mentioned, but you can do biopsies of the duodenum and determine if there are changes that would suggest celiac disease or gluten intolerance. And a lot of times patients that have been dealing with acid reflux symptoms end up actually having celiac disease, and just by eliminating gluten, all of the symptoms get better. So that's another thing that while we're doing endoscopy, we can rule out that possibility. And then we also live in an area that's highly endemic for H. pylori, which is the bacteria that causes gastritis and gastric ulcers. So definitely an upper endoscopy is extremely helpful and helps us set up a plan to resolve or manage.
And then I just have a quick question. Is there ever like a call for like a routine endoscopy, or is it really just if you're experiencing kind of some major symptoms, or is there any like specific age range where it's like, hey, this might be best to have this done just as a preventative or anything like that?
That's a great question. Well, in the United States, there are some established recommendations for endoscopy. For example, if there's a strong family history of esophageal or gastric cancer, that definitely is something that you may want to consider when, let's say, you go for your first colonoscopy. Ask the doctor, hey, doc, my mom or my dad unfortunately had stomach cancer. You think I should get an endoscopy? And probably 10 out of 10 times the gastroenterologist will recommend to take a quick look down there just to be sure that everything's okay. So family history definitely would be relevant. As I said, typically we don't have a standard in an asymptomatic person. It's not like colonoscopies, and we'll talk about that, I'm sure, in a few minutes. But with upper endoscopy, there are certain genetic conditions when you are prone to develop a condition called familial adenomatous polyposis syndrome. Some patients also develop stomach cancer. So it depends on your genetic background as well, in which it would be reasonable when they're doing your colonoscopy also to consider doing an upper endoscopy.
As you just called out, my next question was kind of bringing up colonoscopies, and with the line of work that I do, we have a lot of patients that have a little bit of anxiety towards colonoscopies, and sometimes they'll ask for different alternatives. And I know that there's like the fecal occult blood tests, and I just didn't know, when is one the better option versus the other? Do they really serve? I mean, I'm sure they serve different roles, but can you kind of go into the differences there for me?
Yes, well, I think they complement each other. The examination of the stools for occult blood is a test that you should have on an annual basis. And there is a test that's quite sensitive, which is the FIT test, which is a fecal immunochemical test. Is that directly tests hemoglobin, and you don't have to, with a fecal occult blood test, you have to do 3 days, whereas with the FIT test, it's only one. But the bottom line is you're trying to detect the presence of blood in those tests. So when you're doing this annually and it's found to be positive, then the next step is to do a colonoscopy. So I don't think one is exclusive of the other one. I think both should be done at the proper interval and with the frequency depending on the results of each test. Say, for example, if you get a fecal occult blood test or a FIT test and it's positive, obviously, depending on the age, they're going to recommend to do a colonoscopy. You get your colonoscopy done, and let's say it just shows some hemorrhoids. And down the road, your doctor continues to test you on an annual basis. And let's say 4 years later, even though your exam was unremarkable, the original exam, and you were advised 10 years, but 4 years later, you have a positive occult blood in your stools. In that case, you don't wait for the 10 years. You have to repeat your colonoscopy because you are passing blood that you may not be seeing in your stool. So, as I said before, they complement each other. And with the same principle, trying to prevent the development of colon cancer.
Absolutely. That's awesome. I love that you mentioned that they complement each other because, sometimes how I hear it is it's like a either or, but I mean, that's the perfect way to describe it is, this is your routine. It might be a little bit kind of less anxiety inducing than when you got to go in for a colonoscopy, but to have them in conjunction with each other, like you said, at the correct intervals is, they're just going to work best hand in hand. Kind of bringing up, like, I guess, some kind of different chronic GI conditions. And I'm just going to kind of ramble them off. I don't know. Some might not necessarily be in the same ballpark as others, but like diverticulitis or like IBS or Crohn's, what would be a good lifestyle management for conditions like that? And then I guess, what are the differences? Because sometimes to me, I kind of lose track on the really kind of specific differences of what makes this diverticulitis versus IBS or something like that.
Got it. Well, IBS, irritable bowel syndrome, and inflammatory bowel disease, which is a different condition. IBS is more of a symptomatic diagnosis. Although we are developing new tests to try to confirm the diagnosis with IBS, it deals more with the presence of symptoms that affect your quality of life. Mm-hmm. Now, inflammatory bowel disease also has symptoms that can be very severe, but inflammatory bowel disease is more of inflammation present in the wall of the gastrointestinal tract. For example, people that have Crohn's disease can have involvement through the entire GI tract, the stomach, the small bowel, the large intestine. And the diagnosis is based on endoscopic findings and biopsies. In the case of ulcerative colitis, it only involves the colon. Again, you confirm the diagnosis with biopsies and colonoscopy. There are some blood tests that you can do to further confirm the diagnosis and distinguish between Crohn's disease and ulcerative colitis. So again, this is inflammatory bowel disease. This is IBD, not IBS. Now going back to IBS, which can be something as simple as gas, bloating, diarrhea or constipation, nausea, in some cases vomiting. In those cases, if you did an endoscopy and a colonoscopy and you did a biopsy, you will not see inflammatory changes. It doesn't mean that the symptoms aren't as severe, because I have patients that have very, very severe IBS, and for them, the pain is debilitating and their quality of life is terrible. So the GI tract is a paradox, because you can have, like I said, a perfectly normal endoscopy, perfect normal colonoscopy, and still suffer from IBS. Well, there are medications to help the patient's symptoms and improve their quality of life. Symptoms that are, in one case, very uncomfortable, and in another case, in the case of inflammatory bowel disease, not only uncomfortable, but you can be bleeding and have other signs that can sometimes be quite catastrophic. And you have more organs involved in inflammatory bowel disease. We call it extraintestinal symptoms. But we would have to do another session if I go into further details in regards to inflammatory bowel disease. But IBS definitely is not something pleasant to have. But working close with the patient, and sometimes we have to have the help of a psychologist. Two different diseases, two different disorders. GI doctors are equipped to help with both of them.
Wow, thank you for drawing that distinction. I know, as you could tell, my understanding is very broad, to say the least. And I knew that some were umbrella terms, and that, other different specific kind of disease processes fit under one umbrella versus the other. So thank you for drawing the distinction there. I appreciate it. In your knowledge and experience, is there any amazing GI superfoods that you would just, tell all of your patients, if you could consume more of this, it would just help exponentially? Is there anything that comes to mind as far as just things that we should be having more of an intake of?
And that's also a very good question. The superfoods that you hear often are obviously yogurt. I truly believe that the benefits of yogurt are significant. And in regards to enriching your intestinal bacteria, you have trillions of bacteria in our colon that are constantly being challenged by antibiotics that we take or not very healthy food that we eat. So our intestinal flora is extremely important for our general health, not only for the gut, but there's a lot of connections between our intestinal bacteria, intestinal flora, or microbiota, as we call it, in our general health. So yogurt is an excellent way of maintaining that healthy bacteria, but you have to be consistent. You have to eat yogurt with regularity, almost on a daily basis. And there's different yogurts. Some argue that the natural yogurt, the Greek yogurt, because of its protein content, with natural live bacteria, is the ideal one. So definitely is a superfood. Kefir is also one of those that also is quite beneficial. I also consider, and probably a dietitian or nutritionist would be more informative, but berries are extremely good. They're low in fructose and they're delicious. Bananas are also considered one of those superfoods. So combining those two, the yogurt and the berries, and well, you have there something that's delicious and nutritious. So those are really going to be always on the top of the list. Now, obviously, your dark green vegetables, kale, spinach, broccoli, oatmeal is another superfood. So little variety, but all of those complement each other. And again, those superfoods work in conjunction as pre-probiotics with the probiotics. So yes, those foods, as I said, there's a long list of things. Just a few to point out.
Well, that's wonderful. I mean, good to know. And I was going to say, you just described the perfect ingredients for a parfait. So that sounds awesome. Well, that's wonderful. That's kind of all the questions that I had for us. So I guess I'll just kind of close us out if that's okay. Thank you again, Dr. Munoz, just for joining us and for your wealth of knowledge and information. We're so excited just to have you. I know that I was personally so excited when they mentioned that we were going to be having our own GI come aboard. I mean, I know that, like you were mentioning, there's the population out here needs it. So we're happy to have you. And I know some of my family sees you already, and they just have had nothing but great things to say. So it's just been wonderful. And I loved working next to you. Thank you again just so much for joining and sharing your knowledge with us. I guess that's it for me, unless you have anything else to end off with.
Yes, I'm certainly that. I thank you for inviting me. It's been a privilege and a pleasure to be here. And I do want to say that the Medina healthcare system is really committed to improving the health of the patient population in this area and the surrounding communities. we're here with only one reason, which is to take care of patients in a personal and compassionate way. So it's been a privilege to be in your show. And hopefully we'll be able to, in the future, contribute with more information.
Absolutely. Well, I love that you mentioned, maybe diving deeper into some other topics in another session. So we might take you up on that.
Punch.
Awesome. Well, thank you, Dr. Munoz. I appreciate you so much.
Thank you.
Thanks. Bye.